So we're really patient-centered. I think that's missing in the world of medicine and dentistry today. We don't make patients wait. We address their needs in less than 24 hours, no matter what the need is. And that means our staff has to bend a lot and do a lot of different things to make that work. They have to work extra hard, but that's kind of our motto. We're patient first, and we want to make sure that their need at that moment in time is the most important thing. And then when we are doing our work, we're doing our work, as effective as we can. We're not wasting a lot of time. Doctors are moving around. We haven't, we have enough staff here to allow the doctors to see multiple patients at a time, and they're very in tune to what they're doing. They're very highly trained and highly educated, and they also lean on one another. So we have administrators coming to the back, helping out when need be, and vice versa. So everybody is trained up a little bit on all the tasks in hand, and I think that really comes off on our patients as a great service to them to not have to make multiple appointments for something small or something large. I mean, we hear all the time, many times patients will show up early and we'll get them back before their appointment starts, and they thank us because they have things to do. They may be on their lunch break and we get them back early. We've had patients that come in with a broken tooth and they really want it fixed, and they're shocked that, hey, you can fix that today? I thought today would just be a consult. And we said, no, we don't do consults. We fix you on the same day. So they avoid multiple trips to and from the office. And then when they're here, there's not a lot of wasted time. We've always joked, I think we could probably have a waiting room with no chairs because we don't want people sitting in our waiting room for long periods of time. We want to be different than the rest of the world, and we want to actually keep our appointments and keep them as timely as possible. I think it's all in our training. Our staff is highly trained. They also rely on one another. So if someone is very good at that procedure, they'll come in there and work very effective. But it comes back to just training and learning every time we do something to get better and better and better at it. We're also doing a lot of dentistry, so the more repetition we create, the more effective we become. And the doctors are moving around quickly. We're not waiting on doctors, which is important. It's a very common theme. Our doctors are on standby and ready to go as soon as the patient comes back. So we really just kind of cut through all the fat and make everything very streamlined. At Bonaventure Dental Care, we approach most all of our procedures the same way as if we're working on a member of our family. We work on all the family of our staff, and we work on our own family. So we want to make sure that you have an effective way, a streamlined way without overdoing it. We're very conservative here, but we're going to tell you what you need, and we're going to help you find a way to achieve the results you want in an environment that is judge-free, pain-free, and relatively time-free, so that you don't have to be stuck in our office for a long period of time. And then when you leave, we want it to be the most useful, beautiful, functional dentistry you've ever had, from 1 tooth to 32.